The health department says it's working around the clock to avoid disruptions at hospitals due to load shedding. Taung and Ganyesa hospitals in the northwest are now exempt from power cuts. It brings the total number of such facilities to 77. Deputy Health Minister Dr. Sibongiseni Dhlomo joins us for more on that story. Dr. Dhlomo, good evening. Of course, what we're seeing now is really, a response to the dire situation that hospitals find themselves in when there is no power, and they've been calls for government to have some kind of plan in place. What has it taken to get to this point?
Sorry, you are saying it has taken government to have something in place?
So what I'm saying is it's a reflection of how dire the state of hospitals are. This is when there's no electricity, and there have been calls for government to have some kind of intervention in place to prevent that from happening.
Oh, yeah. No, thank you very much. We do have our support, especially for the 24-hour service in big hospitals, but we did not anticipate that that support, which probably should last you for about 3 hours a day, and then maybe you then go and build up again and have another power fail after a week or so. So the frequent load shedding, actually, which were meant to be able to make us deal with the emergencies, is now very frequent for us to deal with the situation. So what we have as a capacity of hospitals is more than what we can now deliver. Hence, we then made the special request for special exemptions to say a generator that could have done well with 2 hours, 3 hours a day, now sometimes with the frequent load shedding, it probably going to be 6 hours every 2 hours, 2 hours in a day. So that is what has made us and prompted us to then make a request to have this exemption. But however, you would notice that electricity connection and configuration was not done in such a way that it is easy to just exclude that hospital. So it has actually taken that long to be able to enucleate us, to pull us out of an ordinary grid that is supporting me and you in our own house or other entities or other establishments, so that we can be a standalone and be exempted. It's work in progress. You are right. We have moved from 72 to 77 today, and that is not complete. And we are grateful that at least one of our provinces that has been left out completely has now got 2 hospitals in place. Taung and Ganyesa hospitals are already in place in the northwest. Yes.
Dr. Dhlomo, you're bringing me to my next question. This idea of the grid being integrated and the difficulty with isolating certain areas, including areas like hospitals, like schools, as we've seen the Basic Education Department also put in a request. So what has been said to you in terms of how this is going to be practical? Have you already started seeing the benefits of what has been promised here?
Yes, for those hospitals that were easy to actually enucleate or pull out of the ordinary configuration of the grid, we saw that very easily and promptly. But I'm saying this is why it's a work in progress, because before you can have this and that hospital exempted, ESCOM people must go and do that practical moving out our wires from there. It's not an easy thing that you can just do, ask for today and it's done tomorrow. So that is why it's a work in progress. But we have given them a list of our hospitals that we are saying, these are hospitals where we have got ICUs, these are hospitals where we have high care, these are hospitals that are taking a load, and therefore whatever we have should be supported by being exempted, because our generators are not able to do all that. So what we are saying, while we would wish that all those that we have given them as a list should then have been prioritized, is not as easy as give a name, give a hospital, and then tomorrow it's disconnected from that system. It takes them to go and do their infrastructural rearrangements to pull our hospitals out of that connectivity that is there on the ground.
So would you say, Dr. Dhlomo, as we speak tonight, that these 77 hospitals now no longer experience load shedding?
Yes, that is what we have been given. We have seen, I mean, at least the 72. The 77 have just been added this week, so at least I can talk about these 72 where we already have them at least for more than 2-3 weeks. Some of them have been added on slowly and gradually. So those that are added today to 77 should actually be like the 72 that we have already had, where there has not been any load shedding since we were exempted, since we came to an agreement with Eskom on those names.
All right, we'll leave it there for tonight. Deputy Health Minister Dr. Sibongiseni Dhlomo.